We are going to see about the anatomy of the knee joint. So in which we are going to describe about the type, articulating surface, ligaments, the movements and clinical anatomy of the knee joint. So our students will be explaining about the knee joint features and its movements, everything in detail. So with the help of the bones like a femur, tibia, patella, fibula, so the students will be explaining about the knee joint. So first Adarshana will be explaining about the type and variety of the knee joint. Yes, please Adarshana.
Features of the knee joint. It is the largest and the complex joint in our body. It is formed by the three fusions. One is the lateral femorotibial, medial femorotibial and the patellar joint. It is the synovial variety of the joint. So it is called as the condylar synovial joint. The joint is separated by the menisci.
Femur articular surface and patellar articular surface and tibia articular surface. This formed the knee joint. This is femur bone. This is bone's left side bone. This medial condyle of femur. This lateral condyle of femur. Intracondylar notch between the two condyles. This articular surface of the femur attached with the condyles of the tibia bone. Next, tibia bone. It is the superior surface called articular surface. These two condyles, medial condyle and lateral condyle. Condyles between the ridge, intracondylar ridge. Medial condyle. This is the medial condyle. Is large and oval shape. This is smooth, and lateral condyle is circular shape. Next, patella. This is the patella, left side bone. The apex of patella and superior surface of the patella. Two faces between the ridge. Intercondylar ridge.
So this is the anterior surface and this is the articulating surface. This will be not in contact with the articulating surface of the femur and tibia, and this will be the articulating contacting surface.
The lateral facet is medial facet. Lateral facet is large and medial facet is small. Three bones
together
form knee joint.
To see about the ligaments which are present in the knee joint. The ligaments are the main supporting structures of the knee joint. So what are the ligaments present in the knee joint?
There are 11 ligaments present in knee joint. First ligament is fibrous capsule. Second one is ligament of patellae. Third one is tibial collateral ligament, also known as medial collateral ligament. Fourth one is fibular collateral ligament, also known as lateral collateral ligament, and acute popliteal ligament. Last one is sixth one is oblique popliteal ligament.
So the other ligaments?
The other 5 ligaments are anterior cruciate ligament, posterior cruciate ligament, medial menisci, lateral menisci, transverse ligament.
We are going to see about the movements that are present in the knee joint. So knee joint is the major joint which is needed for the propulsion activity of our lower limb. So let's see what are all the movements present in the knee joint. Yes, please tell.
Yes, ma'am. So today we are going to see about the movements of the knee joint. So there is the active movements present in the knee joint is two, flexion and extension. The accessory movements are abduction and the medial rotation and the lateral rotation. So first we can see about the flexion and extension is the chief movements. So which serves the transverse axis on the flexion and extension, which moves forward and upwards during the extension, and the reverse movements on the flexion movement. So the medial femur occurs in 30° at the last extension stage. So when the foot is on the ground while we standing, the medial rotation takes place at the 30° of the extension. So and while sitting like a chair position, the tibia occupies the position whereas the femur. Okay. So next we can see about the locking and unlocking movements, which is so locking and unlocking movements, which is also the chief movements which serves the flexion and extension only.
So can you show the flexion, extension, medial rotation, lateral rotation, and we have locking and locking? Yes, hold.
an extended knee joint. So we can place the patella and
Yes, while doing flexion, the tibia will be going like this manner, and the extension, so the tibia has to roll and come back to the original position. So the femur also has to flex, and this is the flexion movement, and from the flexion this is the extension movement. Okay, so medial rotation happens like this, okay, and lateral rotation happens like in this manner. Okay, so this is the major movements of the knee joint. Yes, now we are going to see about what are the clinical anatomy we can expect from the knee joint.
So there is a major clinical anatomy, that is the degeneration of the cartilages around the knee joint. So this condition name is osteoarthritis. It happens while the age-related problem. It is an age-related problem where the cartilages degenerate easily while the movement is restricted. Due to this degeneration of the cartilage, the movements are restricted, so causes pain to the person. And the next clinical anatomy is genuvalgum, deformities of the knee, genuvalgum and genuvarum. Genuvalgum is abnormally abducted knee locked inwards. Locked inwards is known as genuvalgum, and the abnormally adducted knee is called genuvarum. So these are the deformities of the knee, and the major injuries to the knee can happen due to the injuries to the menisci. Like the menisci can tear transversely and longitudinally. So this is the injury to menisci, and injuries to ACL and PCL ligaments. So ACL ligament can be due to the dislocation, anterior dislocation of the tibia, and PCL ligaments can rupture due to posterior dislocation of the tibia. Thank you.